because it was done in a military center. And the tests were done for a full night period, for all the night, and in a sort of laboratory test and in a hot test, which means that the user were in the system in a chamber with a very high temperature and very high humidity level. Okay, just again, not discussing the result of the test, but I want just to show you that at that stage, this was more than 5 years ago, the system that was used to compare the data was very obtrusive. It was very difficult to avoid that the use of the yarn, the wire, was affecting the use of the garment. And this is the first point. Okay, again, this is just to show that the test was very, very strong because they did the field test and so on. Okay, and the temperature was high so the situation was that the user were sweating a lot. Okay, this was one example of the kind of signal, so a lot of signal for a long period. And this is an example of the situation in which the signal was good, and this is the respiration, and this one is the ECG measurement. Okay, the comparison was done for a period of 50 seconds long, and the results that are really reported here are saying that, okay, the level, the quality, we have a division in first one, same level of quality, two, wealthy, the quality of both were acceptable or good, and the case in which the referee method was better, and the case in which the wealthy method was better. So looking at the final conclusion is that considering just the period in which the gold standard was, the signal coming from the gold standard method was good, and the signal, looking at the signal coming from the wearable method, if we look at the respiration gave a good signal for 100%. It was better compared to the standard method. But if I'm going further, and I talk about my experience in the project that in which we were involved later, and looking at the application, a lot of people doesn't know what to do with respiration. Because for a standard health approach, they are used to use cardiac information, but they are not used to use the respiration information. This is just a consideration of the experience. Okay, I put this slide because this is one of the questions that is rising, why there are no products on the market, and if there are some technological barriers. One of the barriers is still, in the connectors, and in the fact that if you enlarge the number of sensors, you need to cope with a big connector and to adapt the textile to the electronics. Another point is related to the skin electrode contact. I will not address this part, but naturally, if you increase the number of electrodes, you need to get a good contact with the skin, and this is not easy. The other part is okay, the functionality of the sensor in any case is affected by the way in which the garment fits the people. So we will have different, let's say, performance if we are not addressing really well the shape and all the attitude of the user. The last point is that in any case, we have not at all exploited the textile potentiality. We are not at all working with redundant sensors. Still, this part still needs to be addressed. From the economical point of view, this is just a short consideration. I'm not an expert, and I think we will discuss this tomorrow. But in any case, for each application, this is a system, is not a single part, so you need to address all the parts of the product. And in any case, the small enterprise have no resource to reach a massive market, especially if they need to address all the parts. And the last, so far, maybe tomorrow will be different, the multinationals are still too slow. Looking at the future, and this is just something that I stole to Professor De Rossi, this is one of his slides. In any case, what is still, what will be the future in terms of fabric platform? Okay, first, comfort, thermal comfort is still an issue. Attenuated fabric is something that Professor De Rossi presents is a still open issue. Textile communication, wireless communication, the kind of antenna are still too big, non-efficient, something can be improved. The part related to energy investing, I put this because it's one of the last photo coming from our newspaper. Naturally, this is something that is very far away from a real textile system. From the point of view of sensors, looking at what I talked before, the potentiality of textile is still an issue, so you can use a lot of sensors. We develop a sensor for strain signal, and we are just working in discrete conditions, so we are not distributing the sensor all around the body. We are not able to get information about the volume of the body. Also, if this is something that can be in the potentiality of this system. This is my last consideration. When I'm talking about active fabric, I'm thinking something that can feel and can react. This is an example of a product that this is on the market. It's from LBM Technology. It's a sock, and it's a sock for addressing diabetic disease. And this sock is treated in a way to have some micropores and to release a compound. So it's able to release something for the people. And the way in which this substance is released is just for temperature and for movement. So the sock can be recharged after 3 days and giving again this kind of treatment to the skin. This is Outlast technology. I just put this because it's a good example of the possibility to use textile as a matrix on which to put some substance. But what will be interesting is to find a way to address the release in the place in which we need it and when we need it. And I think this is a good challenge. Finally, naturally, I talked about the fact that a continuous distribution is a very complicated story because we need, in any case, to convert all the information to a connector and to an electronics box. But it will be interesting to find a way to read the signal from the border. So this is, again, a challenge for the signal treatment, if you like. And the last, this is my last slide, is sensor location. So where to put the sensor if we go for a redundant configuration. But not last, the fact that we need to interact with the skin. So we need to consider that the skin is one of the more complex organs of the body and is giving a lot of signal. And the dream is to detect what is coming, but also to react in the right way, in the right measure, with the right therapist if it's necessary. Okay, this is my last slide. Thank you for